Good morning, everyone. Welcome to another webinar from Post-Service Department, Office of the Head of Service. Right now, we have just 21 participants, but I would like to crave your indulgence. Please,
Good morning, everyone.
Please, let's have like 3 minutes wait so that we can allow more people to join. So in like 2-3 minutes, we would start, please.
But
Thank you.
I would like to crave your
Okay, I think we can start now. Some more participants have joined. So good morning once again, everyone. My name is Bisi Roland from Post-Service Department, Office of the Head of Service. I welcome you to another session, another webinar session.
I think we can start now. Some more participants have joined.
I'm delighted to welcome you all to today's webinar on high cholesterol and your health. It's wonderful to see so many of us here. And cholesterol, which is a topic which affects many and practically all of us, be it managing our own levels or supporting loved ones.
My name is
Understanding the role cholesterol plays in our health is very important.
I welcome you to
today we'll be exploring how cholesterol impacts our bodies and the risks associated with high cholesterol and the steps that we can take to manage it effectively.
It's wonderful to see so many of us.
We have a doctor in the house who will share her knowledge. She will answer all our questions and inform us on a path to better heart health. But before we start, I would like to inform you that the head of service and the permanent secretary, public service office, are attending council program. The committee of wives of Lagos State officers, so they are unavoidably absent. And also the director post service department, Mrs. Dola, she's unavoidably absent too because she's attending the program.
Doctor in the house who will share her knowledge. She will answer all our questions and the topic will come on
please, I'll be back in like a minute, please. There's an echo, so we would like to work on it before we continue. Apologies, please. Yes, the facilitator, the Dr. Akintimoye Oluwatobi. She's a highly motivated and dedicated medical doctor with a passion for providing excellent care to patients. She graduated from the prestigious College of Medicine, University of Lagos, and she works as a medical officer in the Lagos State health sector. She's passionate about patient-centered care and has skills required to deliver her experience. Dr. Lashe,
Good morning.
the floor is yours, please.
Dr. Akintimoye Oluwatobi.
Everybody.
She's a highly motivated and dedicated medical doctor with a passion for providing.
Hello, doctor, are you there?
To patients. She graduated from the prestigious College of Medicine, University of Lagos.
Hello, can you hear me?
And she works at the Lagos State health sector.
Hello.
Hello, doctor, can you?
Hear me? Yes, I'm with you.
And her skills required.
Please unmute yourself.
I'm not muted at the moment. Hello. I'm unmuted. Can you hear me? Hello.
We can hear you.
Can hear you, madam.
Thank you very much. Thank you very much. Okay, so all protocols duly observed. My name is Dr. Akintimoye once again, and I'll be walking you through the knowledge of hypercholesterolemia. Now, I've heard about high cholesterol. Now, let's get into what it is. So hypercholesterolemia simply refers to high levels of cholesterol in the blood. Now, cholesterol is like a waxy, fat-like substance made in the liver and other cells. It is majorly found in meat, dairy products like milk, yogurt, cheese, lactose, free milk, and fortified soy milk. Now, why do we need cholesterol? Why is it so important? Cholesterol in our body is important because it helps to produce certain proteins that the body needs. Now, cells in the body have walls known as membranes. Now, these membranes need that waxy cholesterol to produce certain hormones in our body, like vitamin D, bile acids. Now, bile acids are hormones that help to digest fat in the body. But the body only needs just a little amount of cholesterol. And that's why when we have excess of it in our body, it usually causes a lot of health issues. When there are high levels, more than what the body actually requires, it forms things called plaques. Now, plaques are deposited within the blood vessels. Now, blood vessels are arteries, veins, nerves, and it makes them hard and prevents adequate blood flow through them. Now, this causes health problems such as heart disease, atherosclerosis, stroke. We'll get into all of that much later in the slide. Now, this is a picture of a blood vessel. Now, our blood vessels are like pipes, basically. It has a membrane, that's the wall, as you can see. It looks like a pipe. There's just a cross section that is open for you to see what's inside of the pipe looks like. Now, through the pipe, blood flows, and blood contains nutrients, cells, and so many other things that are transported from one part of the body to another. Now, if you look closely at this picture, you can see bigger circles labeled red blood cells, smaller ones called HDL. We'll get into that later. LDL is also a kind of cholesterol. HDL is a kind of cholesterol. Now, this is an artery. When cholesterol builds up inside the pipes, that's inside the blood vessels, you have things we call plaques. Now, this yellow substance that you see covering it are called plaques. Now, imagine you have a pipe here and you have excess of that cholesterol formation in your body. The space that is supposed to help transport blood vessels across the body, the plaques is going to cover it. So it's going to what's the word now? It's going to fill up that space. So you have reduced blood flow to areas of the body that is very important that they get blood supplementation. Now let's get to the types of cholesterol. Cholesterol travels through the blood by attaching to a protein. So you have a cholesterol molecule and you also have protein. Now this combination is called lipoprotein. Lipoprotein is the substance that we eventually take your blood sample, maybe when you get to the hospital or you go for a blood test and you say, oh, I want to check my cholesterol level. Is that lipoprotein that when we take your blood, we actually examine in the laboratory to get the level of cholesterol you have in your body. There are 4 types of lipoproteins in the body. We have the low density lipoprotein. This low density lipoprotein is also known as bad cholesterol because it can cause plaque buildup in the walls of the artery. The more low density lipoprotein you have in your body, the greater risk of heart disease that you might have. Now, we have another one called high density lipoprotein. Let's call this the good cholesterol. The high density lipoprotein, if it's present in a good amount, it can actually improve your health. It maintains if you maintain high levels of high density lipoprotein in your body, it increases blood flow, it reduces your risk of heart diseases. Now, there's also another one we call very low density lipoprotein. It's like a sub low density lipoprotein or a sub bad lipoprotein in the body or bad cholesterol. It also works like the low density lipoprotein. You also have another one called triglycerides. Now, triglycerides usually form based on the amount of the kinds of food we consume. If you take excessive alcohol, if you take a lot of carbohydrates, excessive of it. Now, carbohydrates is good for the body, but if you take an excess of it, the storage is usually in form of triglycerides. So triglycerides are usually stored in fat cells throughout the body. Now, what are the factors that affect cholesterol levels in our body? We have our diet. You know, a lot of people say you are what you eat, which is very correct because a lot of us, what forms our body is actually the food we take in. So if you take a lot of foods rich in cholesterol, like vegetable oils, all these unbranded ones, or even the branded ones, it's usually advised that if you want to buy vegetable oil in the market, you should go to a brand that has the cholesterol-free label. At least that one, you know that you're taking your oil, or you can have access to your oil without necessarily taking in cholesterol in your system. You also have palm oil, red meat, eating of poultry meat with the skin, like chicken. If you want to eat chicken and you're trying to watch your cholesterol level, you can take out the skin and just eat the meat. It's very healthy. Dairy products like milk, yogurt, cheese. Don't forget, it's not like you shouldn't take any of these things, but taking them in excess will lead to a buildup of cholesterol. And we know that there's already an importance of cholesterol in the body, so we don't want to have a buildup or to have an excess of it in our body system so that we don't eventually come down with all the complications that comes with hypercholesterolemia. Then you also have lactose-free milk, fortified soy milk, Another thing that can affect the cholesterol levels in our body is our weight. Being overweight or obese can increase our cholesterol levels in the blood. Losing weight can actually help you lower your bad cholesterol and even the total cholesterol in the body. So now, I want to say something about these weight things. A lot of people believe that it's only when you are fat, you can have a high cholesterol level. That's not true. Sometimes even people who are slim, depending on what they eat, if what they eat has a high content of cholesterol in the body, whether they are slim or they are fat, the cholesterol levels in your blood, if it is above the normal limit based off of what you eat, that's foods so rich in cholesterol that you probably have not been controlling the portion, you can come down with hypercholesterolemia based on that. So something else can affect cholesterol. Exercise. Regular exercise can help our body to, get rid of the bad cholesterol and increase the amount of the good ones in the body. So it's important to be physically active at least 30 minutes every day or 1 hour on alternate days. So it's important that we don't just stay in one position for a long time. A lot of us are working, a lot of us are civil servants, and as such, you're moving around, but it's not enough sometimes. You need to do exercises so that you can increase, blood flow to your vessels and, in fact, get rid of the bad cholesterol in the body. Age and gender. That's another way cholesterol is affected. Cholesterol levels rise as we get older due to slower metabolism rates. So as the body is getting older, the cells of the body are getting weaker. So our metabolism or the way we digest food is not as strong as it was. I mean, if you take an elderly person and you take a young child, the young child obviously has better organs and better cells because why? Those organs are still more like brand new. Meanwhile, somebody who is elderly or who is old or older might not have such strength, or the body might not have such capacity to do all the metabolic functions the way it would as a young person. So it's also noted, studies have shown that after menopause, to women's low density levels tend to rise. Now, diabetes is another thing that affects cholesterol level. If you have diabetes, your cholesterol level might be poorly controlled. Studies have shown that, and it's been proven. Also, we have something we call heredity. Heredity means that something you get from your parents or people who formed you, your mother, your father. And there are certain genes that are actually responsible for high cholesterol levels. So sometimes you might be saying that what I'm eating does not have so much cholesterol. Maybe you're the kind of person that actually watches the amount of the kind of food you eat, and you've been very intentional about it. But then you still notice that my cholesterol levels are high. It could be due to heredity reasons, meaning that you might have maybe inherited a gene from maybe your mother's side or your father's side. And such genes that are responsible for these changes are the LDLR. I don't want to bore you with all that information. Apolipoprotein, PCSK9, and whatnot. Then other factors can also affect cholesterol levels in the body, like medications. If a patient or if somebody has epilepsy, you could be placed on anticonvulsants, and that can cause your cholesterol levels to rise. Some people also who might be on immunosuppressants, maybe they had a transplant or they have an autoimmune disease, they can be placed on immunosuppressants, which can actually increase cholesterol levels. Antiviral drugs also are also responsible for this. Antiviral drugs are drugs that used to kill viruses. So people that might be on antiviral drugs are people who might have HIV or hepatitis, things like that. Then we also have beta blockers, which is also a medication that is used for people with palpitation or fast heart rates. Then you also have prednisolone, which is another type of immunosuppressant. You have steroids and even some antihypertensive drugs like diuretics. So if you are hypertensive, you need to actually watch your cholesterol level as closely as possible because you might just be on some medications that might be increasing your cholesterol level. Then you also have some medical conditions that can also increase cholesterol levels in the body. Like if you have a thyroid disease, disease is a disease of the thyroid gland. And the thyroid gland is an organ that actually helps to regulate all other hormones in the body. It's found just in the middle of your neck here. So if you have those kind of conditions, you might have a high level of cholesterol. Diabetes can also, cause high levels of cholesterol. Inflammatory responses like you have an infection, or, fever or something of that nature. Then lifestyle, drinking and smoking. In fact, a lot of diseases are linked to drinking and smoking, not just increased cholesterol level. But particularly cholesterol levels, drinking and smoking does not favor in any way, does not favor the levels of cholesterol in the body. So it's important that we, watch those kind of habits. So how do I know that I have cholesterol or a high cholesterol level in my body? There are signs and symptoms. Usually this hypercholesterolemia that we are talking about, it really doesn't show. People don't really come down with, signs and symptoms until it's really late. So oftentimes we can say it is asymptomatic, meaning that you might not feel anything, you might feel fine, but your cholesterol levels are high. Now, some of the signs and symptoms you might actually see before you get complications are left-sided chest pain, which in medical field we call angina, or pressure or fullness in your chest. So you might be feeling that, oh, I have a chest pain somewhere. You just might be having high levels of cholesterol. If you're constantly feeling dizzy. Now, the reason for this is that those blood vessels that...
Excuse me. Sorry, doctor. We lost you for a minute there. Can you please repeat what you said about the left-sided chest pain?
Okay. So I was saying that more often than not, if you have hypercholesterolemia or high levels of cholesterol in your body, is usually asymptomatic. So it means that you can have those high levels without even having any symptoms at all. And because of that, a lot of people don't know they have hypercholesterolemia until they develop complications. Now, some of those things are left-sided chest pain, which in the medical field, I said we call angina. Now, the reason this is happening is because now, like I explained earlier, the blood vessels are like pipes. So once the cholesterol levels in the body goes beyond normal limits, it starts accumulating in those pipes. Now, when it accumulates in those pipes, the surface area or the space that blood is supposed to use to flow freely through those pipes will be occupied by the plaques. Meaning that the amount of blood, let's say 100 mils, is supposed to get to the heart via a particular blood vessels. You'll be getting maybe like 50 or 30, depending on how severe the plaque formation is. And when you have that, you're already reducing the amount of blood flow that should get to the heart to perfuse the heart or to give the heart all the nutrients it has. Now, when that happens, there's something we call cell death when the cell is deprived of blood. We call it cell death. And one of the symptoms of cell death is pain. So imagine you having the blood vessels that get to your heart, they are clogged with plaques of cholesterol. You have a reduced amount of blood going to the heart, which will give you pain. You now start feeling pain in your chest. So that's how we came about the left-sided chest pain. Or you might have pressure or fullness in your chest. Another one is dizziness. Another one is unsteady gait, meaning that blood is not circulating around your body as it should. So your legs might be wobbly, and things like that. Slurred speech also. Now, if blood vessels going to the brain are blocked by plaques that I explained earlier, it can lead to reduced perfusion of the brain cells, meaning that it can affect the brain. In fact, the brain actually controls every part of our body. So any part of the body that a blood vessel is supplying with blood, but there is a deposition of plaque on that blood vessel, it can affect, you can have any kind of symptom, that comes with shortage of blood to a cell. Slurred speech is one of them. Pain to the lower legs. You start feeling pain in your lower legs just because blood flow is not flowing as it should. Now, there's something we call xanthomas. I'll show you a picture shortly. It's like a deposition of that excess cholesterol on the top of your lid. There's also something we call cornea aqueous. I'll show you a picture shortly. Now, the complications are atherosclerosis. We'll talk about that. Coronary artery disease, stroke, and peripheral artery disease. These are just big names, but in actual sense, they are just shortage of blood to specific organs. Atherosclerosis deals with shortage of blood to the heart based on the formation of plaques. Coronary artery disease is also the same. Stroke, shortage of blood to the brain, which will cause stroke, which will cause neurological deficits in all parts of the body. Then peripheral artery disease is also the deposition of plaques on the arteries. Now, this is what a normal cornea will look like, your eyes. Now, somebody with hypercholesterolemia, you can see the fatty deposit, that waxy substance I explained earlier. Waxy substance is already depositing around the cornea. So the part that is supposed to be white and healthy and perfused with blood cells or blood vessels, you can see blood vessels that is making it look healthy on the left side. Now, the right side has all that is all covered up in the waxy, like structure that we call cholesterol. Now, this is xanthomas, what I was trying to explain earlier. They are deposition of the cholesterol on the inner topmost layer of the eyelid. You can have it in any other part of the eye, but this is usually the commonest that we've seen so far. So coronary artery disease now. This is one of the complications of, high cholesterol levels. The main risk of high cholesterol level in coronary heart disease, if cholesterol level is too high, cholesterol can build up in the walls of your arteries. Now, over time, this buildup is called plaques, which I explained earlier, and causes hardening of the arteries. This causes the arteries to become very narrowed, which slows the blood flow to the heart. Reduced blood flow can lead to angina, that's chest pain, which I explained earlier, or a heart attack if blood vessels get blocked completely. So sometimes it might not even be partial blockage of those blood vessels. Sometimes you can have a complete block of the blood vessels, meaning that blood is not even going to get to the organ being supplied by that particular artery. And that's where we have coronary heart disease. That's one of the major complications. Now, high cholesterol and blood pressure. High blood pressure, which we all know as hypertension, and high cholesterol are really linked. When the arteries become hardened and narrowed with cholesterol plaques, the heart has a strain much harder to pump blood through them. So, that tiny pipe that we're talking about, imagine having to pump blood at the regular rate, but immediately that plaque is formed, the heart now has to apply more pressure or apply more force to pump the same amount of blood through a much, much tinier hole. And that's what will now increase our blood pressure. And that's why some people, when they have hypercholesterolemia, their blood pressure goes up. Now, cholesterol and diabetes. Diabetes can upset the balance between the good cholesterol and the bad cholesterol. People with diabetes tend to have a higher level of bad cholesterol. Now, bad cholesterol sticks to the arteries and damages blood walls. So it's not just even about having the bad cholesterol in the body. The bad cholesterol also has is like a side effect. Let me not say a function. It also has a side effect of damaging the blood vessels of, the body. Now, glucose is a type of sugar that attaches to lipoprotein. Lipoprotein, like I explained earlier, is what we actually check in your blood when we take your blood sample to check your cholesterol levels. Now, it says glucose attaches to that lipoprotein and they form like a protein package that enables cholesterol to travel through the blood. If that compound now remains in the bloodstream longer than necessary, there's formation of plaques, like I've said earlier. So people with diabetes tend to have, high levels of bad cholesterol. So cholesterol and stroke. Atherosclerosis causes arteries that lead to the brain to become narrowed and even blocked, which I explained earlier. So as a result of the narrowing of the vessels, it can lead to a stroke. Stroke meaning that the vessel that is leading to the brain has been affected by those plaques, and that's why you come down with a stroke. Peripheral vascular disease is also the same thing, but this time around in the peripheral parts of the body, that's the hands and the legs. So if vessels leading to all those parts of the body is also affected, you can have that. Now, how do we diagnose hypercholesterolemia? There's something we call lipid panel, or in layman's term, fasting lipid profile. Now, the fasting lipid profile is going to check the amount of total cholesterol you have in your body. It's going to check the good cholesterol in your body. It's going to check the bad cholesterol in your body. It's going to check the triglycerides in your body. Now, if you have high levels of triglycerides, one can link it to, eating high carbohydrate diets or taking alcohol or smoking, things like that. Then advanced testing, that's in a much higher level now. You might want to test for lipoprotein A or apolipoprotein B. Then you also have genetic testing. So sometimes in situations where you might have taken history from a patient and seen that, okay, this patient does not have any risk factor. Like I explained earlier, it could be genetic. So you can actually do a genetic testing for familial hypercholesterolemia. That's if it runs in the family. Now, let's know our numbers. For instance, if you go to do a cholesterol test, I know that there are a lot of us here who just like to do medical checkups without even the doctor prescribing or the doctor asking us to do it. And cholesterol level is one of those levels that a lot of people just want to know. So it's important that you know the values, even if you might not use it for anything, but it's important that you know, so that when you do those tests, you'll be able to tell, okay, do I have hypercholesterol or I don't? Now, the desirable levels that we want is that we don't want the total cholesterol to be less than 200. That's the desire. We want it to be less than 200 rather. That's the desirable levels. But once it's already getting to above 200 and it's getting to 239, then we're already borderline having hypercholesterol. Now, when it's above 240, then we know that this person now needs medication to reduce the cholesterol level in their body. So basically, that's just it. So treatment strategies now, how do we combat this hypercholesterolemia? What do we do to ensure that we actually live a healthy lifestyle? One of the first things to do is exercise, lifestyle modification. You need to do your exercises, you need to take walks. If you need to jog, you need to jog. If you need to go to the gym, you need to go to the gym. It improves the health, improves the amount of cholesterol in the body, improves good cholesterol, and reduces bad cholesterol in the body. Now, dietary changes, what do we eat? There's something we call Mediterranean diet. Now, I won't say you can't eat anything, but it's very important that we know that portion control in life is the ultimate, meaning that a lot of all these things mentioned here, you can take them, but in little quantity. Now, the kind of dietary changes that you would eat that would enable your cholesterol levels to have more of the good cholesterol, things like vegetables, olive oil, whole grains, granules, legumes, fruits and nuts. You can take a lot of that. Fish, shellfish, lean proteins, and low-fat dairy products. Now, physical activity is recommended. Weight management is very important. If one has a weight that is on the high side, they should try to lose weight, because trying to lose weight would also help build good cholesterol and reduce the bad cholesterol in the body. Now, if somebody already has hypercholesterolemia and you've already thought to yourself, will I now start avoiding all these kind of foods? There are drugs and medications that we give to patients who already have the condition, and we call them statins. Now, statins are very efficient in reducing the amount of cholesterol in the body. But we don't usually just place patients on statins. We would have tried a lot of things. We have tried lifestyle modifications. We would have told the person to start physical activity, try to lose weight and all of that. Then much advanced therapies that we can use. Ezetimibe, these are all drugs that, a medical professional would prescribe to patients who might be having hypercholesterolemia. So for the risk assessment now, because of the complications that are associated with having a high cholesterol level, we want to check your cardiovascular risk. So we might want to do some other investigations for you, like an ECG, an echogram, and things like that. So it's important that hypercholesterolemia should not be taken lightly. For monitoring therapy now, it's important that we check our lipid profiles, even if you don't have, or you've never been told that you have hypercholesterolemia before. As an individual, you can walk into a lab and do your test. If you are above the age of 45, every 5 years, you should make it a point of duty to actually check, because prevention is better than cure. Then if you have it, you want to adhere to the treatments that are given to you so that you don't have a relapse. This is managing side effects. That's all the doctor's job. Adjusting treatments. If you're placed on medications and, they are not working for you, if you're seeing a medical professional, they'll be able to adjust it according to your individual needs. So in conclusion, it's important that we, pay attention to our diet. Pay attention to our diet. If you want to take groundnut oil or you want to use it to cook, ensure that you're using the cholesterol-free ones. Those ones that are in the market now, and the label is very bold. They now make it very bold in supermarkets and even any branded NAFDAC oil that is available in the market. Always remember that you are what you eat. Importance of early diagnosis cannot be overemphasized. It's important that you diagnose it early, meaning that you have to do your tests early, and if there's any intervention that needs to be done, it is nipped in the bud on time before it gets to the complicated phase. So thank you very much. I appreciate. Do we have any questions for me?
Thank you very much, Dr. Lashe. We really appreciate your session. It was very informative. Thank you. Before we have our question and answer session, I would like to quickly recap on what she said. Once again, the topic is on cholesterol. She said high cholesterol is a common health issue that can have serious implications on our overall well-being, on our health. And it's a type of fat that is found in the blood. And our body needs it to build healthy cells. So we need cholesterol for healthy cells. But if we have too high a level of cholesterol in our blood, it would increase the risks of developing heart disease and cardiovascular problems and things like that. And she also mentioned the types of cholesterol that we have, which are low density lipoprotein, which are the bad cholesterol. And this increases heart attack and stroke. And the second type is high lipoprotein. Yes. And she also told us about the causes, which are diet, the kind of foods we eat. If we take lots of fatty foods, definitely we would have a high cholesterol. Then lack of exercise, living a sedentary lifestyle, yes. And obesity, being overweight, would cause high cholesterol. She also mentioned smoking, genetics, the kind of genes that runs in the family can cause this. Also diabetes. If one is diabetic, that's a possibility of having high cholesterol. Then she mentioned the health risks, which include stroke, coronary heart diseases. So once someone has a high cholesterol, the arteries will be blocked, so you have diseases. Then she mentioned how we can manage high cholesterol in the body. We have to manage our weight, of course, exercise. The kind of medications too can lower the cholesterol. One has to quit smoking if the person is a smoker. And she mentioned that the symptoms don't show. So it might take a while before the person realizes that he or she has high cholesterol in the blood. So the symptoms include having a left-sided chest pain. You feel lots of pain on the left side of the chest, and dizziness, slurred speech, and which might lead to death. Then the routine checkups, you have to do that every 5 years. So please, let's endeavor to always do a checkup, a routine checkup every 5 years. And the doctor recommended that the cholesterol level should stay below 200 milligrams. Yes, I think that's what she said.
Yeah.
So Doctor, thank you once again. Questions and answer session. I'd like to remind you that you can raise if do we have any questions, please?
Hello.
Hello, good morning.
Yeah, good morning. My name is Mrs. Raji. I have a
Mrs.
question
Raji, good
for the
morning,
doctor.
ma'am.
Good morning. Thank
Yes,
you,
ma'am, please go ahead.
doctor, and thank you, the director of service matters. Yeah, my question goes to the doctor. I just want to confirm, since you told us that diseases like thyroid can be what did you say now? I mean that this of that thyroid can be can lead to high cholesterol in people. Is there any chance that if you continue to use your drugs for a particular number of periods, that it can be averted, it can be stopped at any time?
Okay. So sorry,
Did you get
can I
that,
get
doctor?
yeah,
What?
I just want to paraphrase what she said to be sure that I got her.
Okay.
So you're saying that if somebody has a thyroid dysfunction and they are on their drugs consistently for a certain number of years, that is it possible that the cholesterol levels will drop? Is that what you're asking?
Can be reversed, yes. That's the question.
Okay. All right. I would answer everything together.
Okay.
Good morning.
Good morning.
I'm Mrs. Aquino.
Good morning.
I
ma'am.
want to thank the doctor.
Hello.
And, good morning.
Hello, doctor.
I'm here, ma'am.
Hello. Okay. I want to thank the doctor as well as the post-service department and the
Hello,
HOS.
doctor.
I'm here,
And
ma'am. Can you?
I think we've lost you. Are you there?
I'm here, ma'am. I'm listening to her question.
Okay.
Mrs. Akina, please, could you hold on for a little while? Let her answer the question, please.
Okay. Do I answer immediately the question is asked?
Oh, no, whichever way you prefer. Which would you prefer? Should we take all the questions before?
Okay, I can answer
Dr.
immediately. No
Pons?
problem.
Okay,
I can
answer immediately, please.
Okay, so for people who have thyroid pathologies or dysfunction, if they use their drugs consistently for as long as their thyroid hormones are controlled, yes, the cholesterol levels are reversed. In fact, if you have a high cholesterol, as you're taking your medications for your thyroid dysfunction, you are also going to be placed on something we call statins. Now, statins are going to regulate the amount of cholesterol in your body, such that once it has gotten to a desirable time, you can even stop the medications. So yes, I hope I've been able to answer your question, ma'am.
Yeah, thank you so much. Yes, you have.
All right. Thank you.
There was a second question.
Mrs. Akina, please, you can unmute yourself and
Thank
ask
you.
your question.
Thank you. I have two questions. The first one is sleeplessness, can it be attributed to cholesterol? That is one. Then
Sleeplessness.
yes,
Okay.
sleeplessness.
Okay.
Then the second one, is it only in the chest area that people with cholesterol have things?
Okay.
Thank
All
you.
right. Any other question, ma'am?
Yes,
No,
there's another one.
Okay.
Mrs. Sholanke Abayomi, please ask your question, ma'am. Madam Shanake, please, you can unmute yourself.
Okay, I've unmuted now. I've unmuted.
All right.
Good morning,
Okay.
ma.
Oh, good
Thanks
morning,
to
sir.
our
Sorry.
director. Yeah, Mrs. Jodola,
Good
can you
morning.
hear me?
Yes,
Yes,
sir.
we can hear
Hello.
you, sir.
Yeah,
We can
okay.
hear you.
Yeah, I thank you for our director. You have even made a good analysis. And also the doctor Lashe has explained very well. But because of your explanation, you explain many things that can cause collateral level, like genetic factor, which can be rated, and their organ weakening. You talk of organ weakening, that the body will not perform
Yes.
very well as an adult, and that can cause collateral level. You also talk of medication, like antihypertensive drugs, even diabetic drugs, smoking, and so on and so forth. From this view, it looked like even taking medicine causes cholesterol level. Even our getting aging causes cholesterol level. So I can
Yes,
deduce
you're
that
right, sir.
what I just say is that cholesterol level is normal thing for human being. Because you have analysis, everything that can cause collateral is something we do every day that can cause it. Taking drugs, you have mentioned it. Diabetes, we have mentioned it. Even some other things we eat, you have mentioned it. So it looks like it is something that hardly can someone come out of it not having cholesterol level. That is my submission.
Thank you, sir.
Thank you very much for that question. Let me first of all answer the first question. So she asked if sleepless nights can cause it, and if it's only in the chest region that you can have a you can have a high cholesterol level. No, ma. So sleeplessness is not directly associated with hypercholesterolemia. It's not directly associated with it. Maybe indirectly, but for you to have sleepless nights and then ultimately it causes hypercholesterolemia, no, it doesn't. Then in my slide, I actually mentioned that any part of the body that has vessels, and vessels are found in every part of our body, every part of the body that has vessels, if at any point in time your cholesterol levels
Hello,
are...
doctor.
Yes, can you hear me? Hello, I'm with you, ma. Hello,
Hello.
I'm with you. Can you hear me?
Hello, doctor. Please, could you take that again?
So I said that sleepless nights is not directly affecting hypercholesterolemia in the body. It does not. It does not directly affect it. Then the second question, asked if it's in the chest region that happens. No. And I explained earlier that if you have blood vessels going to the brain and these plaques are formed within those blood vessels, it will block that pipe or that blood vessel and cause a stroke. That's one happening in the head. If it's in the heart, it's going to cause coronary heart disease, which I mentioned earlier. If it's in the legs or the hands, that's the peripheral parts of the body, it causes peripheral artery or even venous disease. I mentioned that earlier. So no, it's not only in the chest. It can affect any part of the body that is being supplied by blood vessels, any organ in the body, basically. But the major ones are the ones I listed, most common ones. I hope I answered your question, ma'am.
Yes, thank you, doctor.
So the next question was, Sal was asking if, I've mentioned so many things, hypertension, diabetes. So the truth is, it's not all antihypertensive medications that causes hypercholesterolemia. No. I mentioned the one that causes it, diuretics. Is only one of those drugs. Antihypertensive, we have like almost 6 or 7 or even 8 types of antihypertensive medications. But the major culprit that causes hypercholesterolemia is diuretics. An example of a diuretic is spironolactone or what's it called now? Let me not bore you with the names, but there are specific types that actually cause the hypercholesterolemia, not all antihypertensive medications. For diabetes, the thing is, if you have all these other diseases associated with hypercholesterolemia, once they are controlled, meaning that you're taking your medications, your sugar levels are not going up and about, they are not dancing around an abnormal number, your blood pressure is well controlled on your medications, then even the cholesterol levels, they normalize. That's just how it works. But the problem is the fact that these other comorbidities are present in the body, they indirectly cause an imbalance of every other thing that happens in the body. And that's why the cholesterol level can even shoot up. I don't know if I've been able to answer your question, sir. Hello? Hello, I don't know if I've been able to answer your question.
Okay. Hello, can I ask my own question?
Yes, ma, you can go ahead.
Thank you. My name is Abosede Oshibodu. I want to know the effects of the shea butter. Ori, is it a bad cholesterol or good cholesterol for the body?
Okay, so shea butter, you're talking about the shea butter that we ingest, right? The one that you swallow.
Yes, the one we swallow, yes.
So, like I said earlier, all the things I mentioned, it's not like you can't take them at all, but in very minute quantity. And shea butter is rich in fat, is rich in butter.
Yes, that's my thinking, yes.
Yes, it's rich in fat. If you take it in little quantity, I don't want to give you a wrong answer because I'm not too sure if it contains a bad cholesterol or a good cholesterol. I don't know if studies have been done on that. So I don't want to give you a direct answer to that question, ma'am.
All right, thank you.
Like I said, in everything, little quantity, little quantity. That is actually. I hope I've been able to answer your question, ma'am.
Yes, very well, very well.
Thank you very much, ma'am. Any other questions for me?
Okay. Apologies once again, network issues. Please, do we have any other questions? I'm not sure if questions had been going on while I went off.
No, I was answering some questions, ma'am.
Oh, okay. All right, thank you. Okay, yeah, we have some questions on the chat box. Yes. I don't know, have you taken them?
Okay, yes, I'm seeing, no, I've not taken those ones.
Oh, okay.
So I can see, do we have an artificial way of testing?
Artificial way, yes, of testing.
So, like I said earlier, when I was talking about vegetable oil, NAFDAC made a rule sometime some years ago that because of the incidence of the complications that arose from excess cholesterol in the body, they started labeling the vegetable oils they release to the market. So if it has cholesterol in it, it is labeled there. You just need to look at the bottle. You will see cholesterol free. The ones that are cholesterol free, you see it written there, cholesterol free, and they usually write it in a bold letter and then circle it maybe in red or something, so you know. So there's actually an artificial way of testing vegetable oils if they have cholesterol or not. And it is indicated in most of the vegetable oils we can see in the market today.
Oh, okay. So it's not all oils that we should take, right?
No. Okay, second question.
Someone said she was told from her test that her cholesterol level is high and she was placed on atorvastatin.
Yeah.
I hope that's right.
Yes, that's correct.
Oh, okay. But she started having pains on her legs, and after she complained to the doctor, the medication was changed to simvastatin. And after she took it for a few months, the pain started. So what can she do?
Okay, so sorry about your experience, first of all. However, if your leg pain is not as a result of high cholesterol level in your body, then maybe that's why the medications are not working. Because if it is due to hypercholesterolemia, like we have discussed, it's really going to work because statins are very potent, anti-hypercholesterolemia medications. So they need to look at other reasons why you have that leg pain. Could it be an infective process going on? Could it be something happening with your veins that has nothing to do with cholesterol? Could it be maybe the valves in your veins are not working and that's why the perfusion to your legs are poor and that's why you're not having that kind of pain. So it could be due to so many other things. If the statins are not working for you, then they need to look at other causes of leg pain for that particular patient. I don't know if I've been able to answer.
Well, Madam Jumoke Adesomi, I hope she has answered your question. There's another one. Can high cholesterol cause sleeplessness? I believe you've answered that question already, but
yes, I have.
Maybe you can just give us a little summary, please. Maybe the person didn't hear the response.
Okay, so I said that no, there is no direct link, and studies have not shown that sleeplessness would cause an increase in cholesterol levels. I don't think so, not directly. If at all anything, it's going to be an indirect process. Maybe your diabetes or your hypertension or medication you're using is increasing the cholesterol levels and you're actually having sleepless nights from that other disease process and not directly from sleeplessness. I don't know if you understand that, but a direct link between hypercholesterolemia and sleepless nights or sleeplessness, no, there is no direct link to that.
No correlation, no direct, okay. Okay, another person, Shogbuyi Kikelomo, she says, in case of hereditary, what can we do? Is there anything, if someone gets it through genetics, what can be done?
Okay, so first of all, for you to get to that point where they are thinking of a genetic cause of your hypercholesterolemia, you would have done some series of tests and you would be seen by specialists. Now, the people who do that are either the cardiologist or the endocrinologist. They are the ones that would screen you. Now, this screening, they don't do it routinely because they are quite expensive. And like I said, before you get to that point where it's actually, they are querying a genetic cause of hypercholesterolemia, it means that all other causes must have been ruled out. All other causes must have been looked into to be sure that, okay, this is not an environmental thing or something about diet or something about weight, and a specialist would see you based on that. And what they do is that there are specific labs that actually do genetic testing. You can't just do it in any lab. It's not a routine test like maybe malaria test or something. So there are specialized tests that they do, and they are quite expensive. But you will need to see a specialist for that.
Okay, so they have to see a specialist.
Yeah. Cardiologist, endocrinologist, majorly.
Okay.
Yeah.
We have someone else, Sholanke. I think we've taken her. We've taken him. Sholanke, yes.
Mrs. Jojai, immediately I asked the question, our network went off. I can't even hear the reply to the answer.
Oh, I'm so sorry, sir.
The network went off. I can't hear it. I just come back now. So I want to hear the reply to the question I asked. Sorry.
Can you quickly please take your question again?
Okay. Yeah, thank you, Dr. Lashe. I said from what you have said, you talk of genetic factors, inherited factors, weakened organ for elderly that can cause the level of cholesterol. You also mentioned medication like antihypertensive drugs. It can cause the level of cholesterol. The issue of smoking, drinking can cause the level of cholesterol. Then my question is that almost everything we engage in daily activities cause cholesterol level. You talk of drugs, you talk of genetic, you talk of weak organ, you talk of drinking, and you talk of some other things. So from my own view, it looks like there is no way someone can escape this issue of cholesterol. So I now ask, is that what you are just saying?
Okay. So I answered this question earlier. Thank you for that question.
My network went off immediately. I just came back now.
No problem. All right, sir. So first of all, it's important to know that hypercholesterolemia is one of the major diseases of the elderly. It's important to know that. So if we see such a disease in a young person, we now begin to think, okay, what is the reason why a young person is having this? Because it's not usually seen in young people. That's first. Secondly, sir, when I was talking about hypertension and diabetes or other comorbidities that are associated with hypercholesterolemia, I mentioned that it's not all the medications used to treat these disease processes that can actually increase the cholesterol levels. For instance, for hypertension has about 6 or 7 classes of drugs that they use to treat it. But it's only one class of drug that can cause hypercholesterolemia, and that's diuretics. I mentioned it earlier.
Yes.
Only diuretics amongst the multiple numbers of antihypertensives that we have that can actually cause an increase in cholesterol levels. Now, if somebody has an increase in cholesterol levels and they are placed on that kind of drug, they will change to another type of antihypertensive. They won't remain on that one because they know that it can facilitate an increase in cholesterol level, and they don't want to have 2 types of comorbidities coexisting together. You're treating one and then you're precipitating another one. It's not done. Do you understand, sir? So we don't do that in the medical practice.
Yes.
And also, smoking and drinking, all these habits, like I said again, it's important that in everything, Yorubas will say, "Iwonba ni nkan." You do things in moderation. Now, when I say eat certain foods, it's not like you shouldn't eat it at all. Yes, excessive carbs can cause a high cholesterol level, but doesn't mean you will not eat rice. You would eat rice now, but you will eat it in little quantity. It's not an excess of carbs that you would take into your system. Do you understand? And I mentioned the kind of foods that we should eat. We should take more vegetables, more fruits. Those kind of things, they don't increase cholesterol levels. They don't. They are very neutral, cholesterol neutral foods. They don't increase, they don't decrease. So you eat fruits, eat vegetables, eat nuts, eat legumes, stay away from red meat, stay away from palm oil. All those palm oil, bleach palm oil, there's something they call it in Yoruba, I can't remember now. But vegetable oil, to be safe, if you want to use vegetable oil, I explained earlier, there are vegetable oils that are cholesterol free. Those are the ones that we should consume. I don't know if you understand me, sir.
Yes, I'm okay.
Basically, it's not like you shouldn't do, it's not like everything causes hypercholesterolemia.
Okay.
Yes. So they are just specifics, which I highlighted, sir.
Okay, thank you, ma'am. I understand now.
Yes, sir. Thank you very much for your question.
Thank you, sir. There's another one. I think that will be the last one we will take in case there's no other one. But anyway, the person asked if regular exercise can help maintain cholesterol.
Yes, it's
regular exercise.
Yes, it can. I mentioned earlier in my slide that doing regular exercises, at least 30 minutes every day or 1 hour on alternate days. If you do that regularly, it's going to help your cholesterol levels. In fact, to help build up the good cholesterol and reduce the bad cholesterol. There is a pathophysiology behind that, but I don't want to bore you with all that information because it's a medical thing. But just know that how doing exercises actually reduces bad cholesterol in the body.
Okay. So I phoned Joseph. I hope you got that. So we have to exercise regularly, take walks and things like that. Do we have any other questions, please? It's 11:33. Okay, there's a suggestion. Let me just quickly read through it. Dr. Nike Uduwole, she says that we should reduce our animal fat intake, eat more fruits and vegetables, get rid of all scums. I'm not sure what that means. We should get rid of all scums on meat stocks before cooking, because this will help a lot in reducing hypercholesterol anemia. I hope I got that. Dr. Britt, can you tell us what that scums mean? I don't know if it's the medical term. SCUMS.
I believe that she's talking about
the fats.
Yeah, the broth, you know, when, okay, for instance, now if you take beef and you boil beef, if you leave it
Yes.
to congeal, like the broth now from the meat that you have boiled, if you leave it to congeal, you'll notice some fatty, like yellowish
Okay.
thing that settled on top. That's what she means by the scum. It's like
Oh,
oil.
okay.
So when
Okay.
the broth is still hot, you see it as they look like oil on, as if you put oil on top of the meat. But when
Yeah.
it's cold, when the broth is cold, you see it's like congealed fat.
It hardens.
Yes, hardens. So that's what she means by the scum. So if you can maybe filter out that part of the, what do they call it? That part of the broth, and just
Yeah.
deal with the water alone, then you will be reducing your cholesterol level, but in the food you cook.
Oh, okay. Okay. All right. Thank you, Dr. Nike Odowale, for that suggestion. Thank you very much. So everyone, just a summary of everything. We should please endeavor to have routine checkups. This is very essential to monitor our cholesterol level and to detect it early so that it can be easily managed. And this would help prevent complications. I thank you once again, Dr. Lashe, for your enlightening lecture. We really appreciate your presence. And I'm sure if we call on you again, you would attend to us. Thank you.
Yes, ma'am.
All right, thank you. Quick one, please. Okoli Olufunke. She has a question. I think that will be our last question for today, please. She has a question on creatine. Is that, can you see it? Creatine or creatine? Creatine.
Does she mean creatinine?
Oh, well, I'm not sure. Okoli Olufunke, please, could you,
On the group.
how do I lower my creatine? Yes, it's the same word, creatine.
Well, I want to believe she means creatinine.
Okay.
Yes, yes, I need creatinine.
Okay,
That's
Oh,
it.
okay.
Okay, so creatinine is one of the biochemicals in the body that is usually made in the kidneys. So an elevated level of creatinine is an indication that the kidneys might be dysfunctioning, meaning that they might have a malfunction of some sort. And the way to reduce high levels of creatinine is usually through well rehydrate, what do I call it now? When you are well hydrated, you need to hydrate yourself more, drink more water. But there are levels to this creatinine elevation that if it's above, you will need to do a dialysis, meaning that they'll need to maybe use a machine to actually get those excess creatinine from your body, because it's not easily taken out like that in our urine. It's a very important chemical, and it's an indication that the kidneys might be shutting down or the kidneys might be dysfunctioning. So if you have high levels of that, that's almost, quite, I don't want to say it's unrelated, but it's a bit abstract.
Mine is just a little bit elevated, I think 1.2. So I was asked to actually withdraw quite a number of things from my diet and take a lot of water like you have suggested. But I'm asking whether there's any deliberate step that can actually be taken to take care of that. I have like 1.2 by the test that's read. I don't know all this, the medical whatever thing, but they just said deliberate.
So a deliberate way that you would actually take care of your creatinine is to stay hydrated. That's the most deliberate thing you can do. And to eat healthy. To eat healthy, to stay hydrated. Now, the kidneys are the kind of organs that if you give the kidneys water, they'll be very happy. That's how the kidneys work. So the first thing that shuts down in our body when we're thirsty is the kidneys. So if you give them water, if you're well hydrated, your creatinine level is going to remain normal. But once the kidneys are deprived of water, the creatinine level goes up.
Okay.
So it's important
Okay.
to stay hydrated. It's important to eat good food and healthy food. This cholesterol we're talking about, stay away from it as
Okay.
much
We
as
should
you
stay
can.
away from it. Is that what you said?
Yes, ma'am. Stay away
Oh,
from
okay.
things
Both
like
animal and plants. Both
Yes.
animal and plants. Meaning that
Yes.
there's no healthy
No.
protein.
You can eat fish. You can eat fish. If you want to eat poultry, the only advice I'll give you for poultry is chicken. And you can eat it without the skin. But like I said again earlier, quantity is very important. Moderation. You can't be eating chicken every week or eating chicken every day. Once in a while, you eat chicken, that's okay. Eat chicken without the skin, that's fine.
Thank you.
Yes, ma'am. But fish is also a very good source of food, of protein, without necessarily taking in cholesterol.
Okay, thank you, Madam Funke Okoli. Someone said he just joined. So please, last question, please. Does high cholesterol have to do with body mass? That is fatness. I think, yeah. Does
So,
high cholesterol have to do with body mass?
yes, like I explained earlier, in the factors that I mentioned cause hypercholesterolemia, I talked about BMI and weight. Now, the body mass index, which I believe is what you're talking about here, is the ratio of your height, to your weight. Now, when that is elevated, it could be as a result of excessive fat in the body. So when there is excessive fat in the body, some are stored as some of the components of the cholesterol that I mentioned, high density, low density triglycerides and whatnot. Body mass index is actually directly proportional, is directly linked to high cholesterol levels. I hope I've been able to answer you.
Hello, madam. I hope the person,
I hope I've been able to answer you. And then I also mentioned that there are some people who are actually slim, but they also still have high cholesterol levels. And that's when I start talking about genetic testing. And I start talking about the food we eat. And I said, you are what you eat. So if you eat foods that are high in cholesterol, but you're not necessarily overweight, you can still have a high level of cholesterol without necessarily looking very big.
Oh, so someone can be slim and still have a high cholesterol. Is that what you're saying?
I've seen some patients like that. And then we wondered, okay, and then when we investigated further, we saw that okay, there was a genetic predisposition as to why this patient had a high cholesterol level. Yes.
Okay.
Please, sorry for this question. I needed to ask. Like we check routinely our blood pressure and our blood sugar. What kind of tests can we actually be using regularly to check also our cholesterol level?
Okay, so when I was doing the presentation, I actually mentioned it that we do a fasting lipid profile, meaning that when you're going to the lab to check, you're going on an empty stomach. That's why it's called fasting. Lipid profile, meaning that you're checking those components of cholesterol that I mentioned, the high density, the low density, the very low density, and triglycerides. Those are the components we do. We either call it a lipid panel or we call it a fasting lipid profile. So that's what we do. And usually, we don't do it routinely except we have indications. However, if you want to check on your own, you're very free to do that. If you're above 45, like I said, you can check every 5 years. But it doesn't mean that when you check and you're above 45 and you check and you see that, okay, it's actually high, that means you might have to do a more frequent check for it.
Thank you.
I hope I've been able to answer your question now.
Yeah, thank you.
Yeah. I think we might have to take this question, please, doctor. The person asked if there's any effect cholesterol has on the sexual activity of men. I think that's an important question, I think. Did you hear that?
Yes, I did.
Okay.
Okay, so when I was giving this presentation, I mentioned that any part of the body which has blood vessels, which is every part of our body. I mean, for our body to function, blood vessels has to be running in and out somehow, somewhere. And I don't know if this person is asking for males or for females.
For male,
But
for male.
Okay, so for males, if your blood, the vessels supplying the male reproductive organs have some form of plaque deposition, like I mentioned earlier, yes, it could. There is a possibility, but we've not recorded so many cases of such. I don't know if I've been able to, I don't know if that will suffice.
Can you take that again?
I said that we haven't recorded so many cases of hypercholesterolemia, you know, affecting sexual function. But yes, there is a possibility because the reproductive organs are made of blood vessels. And anywhere there are blood vessels, it means that there is a possibility of plaque deposition. And if there's a possibility of plaque deposition, it means that there is a possibility that cholesterol might affect, you know, those organs.
Okay.
Yes.
Okay. Okay. All right. Thank you, everyone. We appreciate your presence today, and I'm sure we've learned so many things about cholesterol. So as we, thank you once again, Dr. Lashe.
Thank you.
Yeah. Would anyone please volunteer to appreciate our doctor for the wonderful presentation? Hello, sir.
Yeah, Mr. Sholaka, I want to move it. We really appreciate even the effort of our Director Post Service, Ms. Jodola, in your analysis. Even if someone is not listening before, by the time someone gets that, you are doing your conclusion, you give us the highlight. Also, I must thank Dr. Lashe for giving all these highlights and detailed explanation on cholesterol issue, how we can avoid it, what can cause it, and the effect. So you have enlightened us very well, and we are appreciating your effort. And God continue to bless you and strengthen you in Jesus' name.
Amen. Thank you very much, sir. Dr. Lashe, thank you once again. We really, really appreciate you. Thank you, ma'am. So as we usually do, please, we can all unmute ourselves and say hello to one another. I'm sure it's been a while we've all seen each other. So please kindly unmute yourselves. Thank you.
Hello, Ms. Jodaye. I know I'm wishing out happy birthday, Ms. Jodaye. Ms. Jodola. I have not been receiving any birthday gift or wishes since 4 years ago. I received one.
Oh, okay, sir. Please, can you come to the office? We will attend to you there.
Okay, ma'am.
All right,
before
sir.
you have been sending message that we should come and get something. So until I come now.
Yes, sir. We'll attend to you there, sir.
I will come. My birthday is August 30. So
all right, sir.
There. I will try this week.
All right, sir.
Okay, thank you, ma'am.
You're welcome, sir.
I agree to it. All
right, sir. I don't know. Can we please unmute ourselves? Mrs. Okole, thank you for joining. Mrs. Akpino, thank you. I'm not sure why people can't unmute. Okay. Oh. Yes, I'm sorry. Please, you can unmute yourselves now. I'm sorry about that.
Okay.
Yes, sorry about that.
Before. Thank you so much. Thank you so much.
Yeah, very welcome.
Has been helping us a lot.
Bless you.
Contributed healthy living.
Thank you
so much.
Thank you, everyone.
Thank you for wiping away ignorance.
My director and doctor, I want to say thank you to two of you.
God bless you. God bless everyone.
Director.
Bless
Mrs.
you all.
Sudodara, you are super.
I really
Mr. Agbayu, I see you. Thank you.
You are a superwoman.
Okay, now.
You will retire in good
I
health
can
in
see you
Jesus'
too.
name.
Well done. Well done.
All right, sir. Thank you, everyone. So
Thank
in
you.
the next 2 weeks, by God's grace, we would come up with another session. Thank you, everyone. Remain blessed.
Thank you. We have not regretted we work with Lagos State. Thank you. Our children and grandchildren, they are enjoying us. Thank you. From Education District, so absent. Thank you very much.
Thank you, everyone. Bye-bye.
Wonderful.
Superwoman.
Thank you.
Yeah, see our face, the directors, permanent secretary. Happy to tell you all